Thank you for watching the video today. It's a very typical nail cutting, not a lot of anything special going on. I do have a conversation, however, with this patient's interpreter regarding getting the coronavirus vaccine, the COVID vaccine. I'm not going to dwell on it right now, but stick around at the end of the video, and I do have some thoughts and some resources I'd like to share with you if you have questions about whether you should be getting the vaccine or not. So stick around after the video and enjoy.
Yeah, the speakers, they follow everything.
Good.
What, it is this couple, like every morning they walk
Good.
together with your husband.
Good.
And every evening, every,
Yeah, good.
and keep, that the house clean and the gloves on and the mask on, so.
Good. All right.
What about you, Doctor?
So far so good.
Good.
Yeah, just living the dream.
Yeah.
And I've discovered that I like staying home and going home after work without plans. I kind of enjoy that. So maybe I'm more antisocial than I thought. Just kidding. Sort
What
of.
do you think about the vaccine? Will you do for yourself or you don't? You will?
No question. Absolutely.
Видишь, она говорит, я без всяких вопросов, она будет тоже вакцину делать.
А некоторые же умирают.
I stopped and I didn't have any food. Now I don't know about my body. Is it good to have that vaccine and all of a sudden I will get
Yes.
that?
No, you're not getting the virus. What you're getting is an immune reaction to the proteins in the vaccine. So just like with the flu shot, I would always get a fever for a couple days and it felt like the flu, but it's not. It's your immune response mounting to the vaccine. So by getting the vaccine, it may not stop you from getting COVID, but what it will do is it will make your symptoms way less. And that's important. And even more important, it will keep you from bringing it home to your family. You're much less likely to get COVID and therefore less likely to pass it on. I think everybody needs to get vaccinated unless there's a very specific reason they don't.
Which one we have to use?
It doesn't matter. It doesn't matter. Do you ask what brand of tetanus shot you get?
Uh-huh.
Nobody asks that.
No.
They're the same. And their efficacy, how well they work, is about the same. So you get whatever is available. Just like when you get your hepatitis B vaccine, or you get your tetanus shot, or you get your, we didn't ask who made our polio vaccine, did we? But there's no more polio because everybody's vaccinated. So that's my little soapbox. When they call you and tell it's your turn, tell you it's your turn, go get it.
Because we interpreters are like the nurses are,
Right.
because we come to the clinic
Right.
each and every time.
Right, the interpreters are essential healthcare personnel. So you should be able to get it now. And I would not even question it at this point. I would just go get it. Because you fall into the age and you're an essential worker. So. That is my little soapbox lecture. All right, everything here looks very good. Oh, I'll get those little calluses.
Само тебя немножко что-то она снимать, наверное,
Да.
на топ.
На топтиш.
Okay.
It's hard skin.
Yeah, just чуть-чуть мазоли.
Чуть-чуть.
When she's on the hills, then she feels something. Так, когда ты на каблуках, тебе больно?
Да, да.
Yeah.
Right, because you're putting all your weight right here.
Ага.
So,
Поэтому, потому что весь твой вес упирается на эти пальцы, вот поэтому.
so I'll just take out these little cores. How often are you wearing heels these days?
А когда без каблуков?
Не, без покупок.
Without heels, she's fine.
Okay.
Надо ей сказать, что я вены делаю.
А?
Вены, что мне делают.
She wants to show you the veins by your, yes.
Okay.
And she was treated, and in 3 months she has follow-up, but she got about 5 or 6 appointments before, and that guy actually speaks Russian and Ukrainian a little bit originally.
Какой?
His parents, Andrew, and his Russian name is Andrei.
Oh, he's from Minneapolis Minneapolis Vein Clinic.
He
Right.
is in Vein.
Oh, Vein Centers of America.
Vein Clinic of America.
Of America, yeah.
This is
Okay.
the one.
Yep.
Actually, you gave us the
Right.
advertising stuff.
Yep. I think you told me about that. And are your legs feeling good now? Are they feeling better?
Yes, теперь у тебя лучше
Да, да,
гораздо?
мне лучше.
Yes, he left leg was full of those varicose,
Uh-huh.
and now it is straight, as if she didn't have any.
Good. Well, then I'm glad I gave you the referral.
You know what? I gave your name.
Mhm.
Him. Where from did we know? Now he advertising in our Russian.
Very good, very good. And as long as you feel better, too. Your legs don't get so tired.
Чувствуешь тоже себя хорошо, правда?
А?
Чувствуешь себя
Да,
лучше,
да.
yeah. She feels much better.
Well, that's great. And so now now that he knows there's a pretty big Russian community here, you said he's advertising to them?
Yes, then I don't know because what actually is good for Russian speaking, because he understands
Right.
Russian. It is not a problem just to have a test or whatever. When people go to the clinics and the doctor is speaking their language, I can compare.
Right, it makes a big
For 20 years
difference.
I run that business.
Yeah.
Some people, they like to hear from the doctor. Sometimes they like to have interpreter because the doctors sometimes are not so clean or something. It depends.
Right.
But in his papers, he says that he understands Russian and Ukrainian.
Wonderful. That's good to know, because then I can send more of my Russian and Ukrainian patients there. Okay, носочки, пожалуйста. All right, well, your feet look great, and
Ноги нормально.
I think we're good for another 2 months or 200 miles.
Через 2 месяца еще придем.
And I'm very glad that your leg's feeling better.
Она очень
Okay.
рада, что у тебя ноги
You're welcome.
лучше.
So I want to take a minute and just talk about the COVID vaccine. So you heard the interpreter in this appointment was asking me questions and expressing some reluctance to get the vaccine. And I even had a gentleman come into my office last week who said that he didn't want to get the vaccine because he had heard that the mRNA, the messenger RNA that's in this vaccine, is going to alter our DNA and make us, his words, patentable, just like a GMO food would be. And so I just want to set the record straight on a couple things. So first of all, the mRNA that is in this vaccine does not even get near our DNA. It goes into the cell, the DNA is in the nucleus of the cell. This mRNA does not affect our DNA at all. Secondly, this mRNA type of vaccine, if you remember SARS from 2005 and then MERS, they have been working on this vaccine for 15 years already. So when this coronavirus came along, they were in the perfect place to go ahead and immediately find the particular proteins in this virus that they could link to this mRNA type of vaccine and deliver the immunity that we need. So it is a safe vaccine. Every doctor that I know who has been eligible to get it has already gotten it. And I don't know anybody who's had any serious after effects other than sore arms. Now, of course, that's just me in my little world, but I want to introduce you, if you don't already know him, to a doctor who goes by the name ZDogg, and he has a group of, I guess you could call them followers. He calls them the Z-Pack. And he talks about issues that healthcare providers are facing on a daily basis in today's medical environment, but he also has a number of videos that I will put links to in the description, where he talks specifically about some of the myths surrounding the coronavirus. Now, he's an MD, he's from Stanford University, internal medicine, and even he brings in some specialists in immunology and vaccine medicine to help get the very specifics of the questions answered. So again, I'm a podiatrist. I know what I learned from my immunology classes and microbiology classes. Yes, things have changed since I was in school, but I think that it's important that people get the right information from the right sources. And as ZDogg says, Dr. Demania, he says, let's science the crap out of this so that your questions get answered and it makes sense to you and you're not hesitant or afraid to go ahead and get this vaccine. So when it's your turn, I'm hoping that everybody watching this will go get your vaccine. That's the only way we're going to knock this virus out. And it doesn't matter whether you get the Pfizer or the Moderna, the two that are available right now, because their efficacy or how effective they are is almost exactly the same. And as you hear me say to the interpreter in this video, did we ask who made the tetanus shot we got? It doesn't really matter. What matters is that it's been FDA approved. All the trials and all the studies have been done. Nothing was skipped. You know, the name Operation Warp Speed was probably a really bad idea because it sounds like they cut corners to get this thing to market when the truth is that they didn't. So listen to the people who know instead of some person who writes an op-ed piece that they publish on Facebook, because they don't know. And anybody can say anything, but listen to the people who actually know. Look at the links to ZDogg's talks, a few of his videos that I'll put below in the description. And once you have the facts instead of what people say they think they know, then make your decision. So that's like I said, my soapbox. That's my opinion. And I hope that you can all come to a comfortable conclusion for you. But I would recommend getting your information from the experts instead of the guy on Facebook. So that's all I got to say. Thank you for listening.